Yay, we're live. Hello, humans. Happy Friday. Dr. Sarah here with Performance is Happening, and we are doing another interview series for the Total Worker Health Symposium that goes down next week. And today we are joined by Dr. Lili Tenney. Hello, Lili. So nice to have you here.
Hi, Dr. Sarah. Hi, everyone. Thanks for having me.
Awesome. Okay, I'm going to read her bio. She's amazing, and she's like in charge of the whole event. So if you guys have any questions, we're not answering any questions live, but afterwards we'll check the comments below. So go ahead and ask your questions. Also, a reminder, and I'm going to ask Lili to make sure this is true. You can still register, correct?
Registration ends tonight at midnight. So hopefully we can get this out. We've got 280 people registered. So looking to get in today, you can still get in.
Okay, awesome. And what I learned last week is the good thing about now that we are completely virtual, when there are two sessions that are going on at the same time, which happens at all these amazing conferences and the same things, you want to go to both. Now you have access to recordings for 30 days. So that's amazing. Yay. Okay.
Yeah,
so
definitely one of the silver linings for sure.
Yeah, you got always, the more positive things that we focus on, the more positive things we see. So, okay. Today we are joined by Dr. Lili Tenney, the Director for Strategy and Programs at the Center for Health, Work, and Environment, where she leads the Total Worker Health Center of Excellence. She also serves as faculty at the Colorado School of Public Health and is a co-founder of HealthLinks, a program that helps organizations create safer, healthier workplaces through assessment, consulting, and certification. Dr. Tenney's work centers on bringing science to action, designing real-world interventions that improve worker health, safety, and well-being. She's also been instrumental in shaping the vision for this year's symposium and advancing conversations about how business sustainability and employee well-being can thrive together. Yay.
Thank you.
Impressive. Okay, so as the program chair, you had a front row seat to all the moving parts of this year's symposium. What's the overall vision or theme behind this year's event?
Well, we had the opportunity, and we being the Centers for Health, Work, and Environment based at the Colorado School of Public Health, we're one of 10 national centers of excellence for total worker health. And in 2022, we had the opportunity to help plan and organize this event with the National Institute for Occupational Safety and Health, NIOSH. So over the last 2 years, you do something like that and you finish it up and you kind of jump right into planning for the next 3 years later. The whole vision for the symposium is to serve as a gathering focused entirely on the multiple disciplines that are not only passionate, but are doing the hard work to integrate worker health, safety, and well-being. And so it's our goal to bring together not just the research community, the scientists that are doing this work, but practitioners, employers, labor representatives, policymakers, to really be able to share innovative practice and learn from each other and really look at some of the solutions that are front and center to really tackle some of the biggest challenges we're facing today.
I love that. Giving a more holistic perspective, because I find a lot of conferences or symposiums, it's very academic, or then it's for the practitioners. And this is a great opportunity to bring all those great minds together to share what works and how you take theory into practice and all that. So that's awesome.
Yeah. I think too, it's, we're at this moment where not only work and health are so deeply intertwined, but I know through your work, it's that how complex it is between work and health and life and all the different scenarios and situations, experiences that different individuals in different workforces are facing. And so being able to have so many different shared perspectives and not only just focusing on the challenges, but really being able to celebrate the progress we've made and acknowledge the complexity of those challenges so we can really have a solution-focused mindset. And that's what we've found through these previous symposia, is that we have people who are doing such amazing work in the field and through their work with employers and different organizations, that so much of that learning is being brought together through this event.
Yeah, I love that. Everyone I've been interviewing has such a wonderful perspective. First, a lot of them have been about psychosocial perspectives. Where like, I feel previously, even like 5 years ago, it was, you think of safety and health as like physical and then, well, mainly physical and then keeping the employee safe. And I love, because a lot of what I do is mental health as well, is the incorporation of the full human, the holistic perspective of not only how to keep that human happy and healthy at work, but understanding that we are not robots, at least not yet. And that when you can be supported at work, you can also be supported in your life, because we're humans, we don't just fit in a box. So
absolutely, we've really seen that shift, and there's always, that's why I think the field of total worker health has really drawn so many practitioners and people from psychology and even industrial organizational psychology to be looking at the work arrangements and how systems can really affect us as humans in a work arrangement. But the other thing that you just touched on is the need for us to be considering that each of us are all individual humans with our own experiences. And so that requires a very different approach than what we've seen traditionally in occupational safety or in occupational health, where we have evidence-based interventions or system approaches that really focus on populations, and expanding that to what you said, which is this more holistic approach for being able to have programs or efforts, strategies within organizations or programs that can really meet the needs of individual workers.
I love that. That's amazing. Let's transition to, well, not necessarily a transition. I want to kind of go off of that. What excites you most about this year's symposium? And then two-part question. What do you hope attendees come away with?
Ooh, okay. I'm excited about so many things. As you said, as you've noted, we have been in a position where we've needed to transition to a fully virtual format, which does allow more access to people who didn't have the means or approval or ability to get to the DC area, to Bethesda, where we were going to host it at the NIH facilities. And so I'm excited that we're going to be able to have greater access for attendees to show up. I'm really excited for the general and plenary sessions that we have. A couple of keynotes that I want to make sure to highlight for everyone. We have our opening session, which is going to be focused on a presentation and opening remarks from the NIOSH director, Dr. John Howard. Dr. Howard is the godfather of total worker health. He has been so fundamental in really shaping the vision for the field and continuing to support that. So I'm excited to have opening remarks. We also have Dr. Asari, who's going to be presenting on back to the basics and really thinking about focusing on fundamentals to drive change. And I think that session is going to be incredible because we're going to be reflecting on what you were talking about, which is meeting people where they are, thinking about how we can ensure meeting the needs of all employees and that connection between health and experiences and belonging at work, and how that the workplace can either support or strain those balances. So the keynotes for day one are going to be great just to kick off and get some really good energy going. We have so many, I think we have 67 sessions throughout the course of 2.5 days. And so I just encourage everyone to check out the website, view the full agenda. One other session I wanted to mention is our fireside chat on Friday morning. That's Friday, October 24th. We're going to have Dr. Raneet Mashori, who's the Chief Health and Safety Officer for the World Bank Group, who's also a member of the Health Action Alliance Commission for Climate and Workforce Health. And I'm excited about that because just as you mentioned with mental health, that and the focus on some of the psychological, psychosocial factors that are affecting humans and working populations right now, she's going to be speaking to climate, the impacts of climate on our organizations and our workforces. So that's not to be missed as well.
I love that. One of the key themes that has been coming up through all these interviews that I've been doing is two things. One, you mentioned it, like meeting the person where they're at, but also change happens at the organizational level. And I feel like that is something, both of those things are so important to actually make real change, transformational change, behavioral change that makes a difference versus like kind of this lunch and learn about whatever.
Yeah.
But that's something that I'm super passionate about and keeps coming up over and over and over again. So I feel like what you've been doing with Total Worker Health has been phenomenal because it seems like it's making a difference and people are talking about it. Because even a few years, it would be, let's help leadership or this individual. And yes, we have to help the individual for sure. But it's also not a one size fits all program. And it's not a individual issue. It is an organizational issue. And it's what that individual needs is very specific compared to what the next individual needs. So I'm just, that's amazing.
So you said it really well. The other opportunity that Total Worker Health acknowledges is that it's not one size fits all. As we know, there's so many unique needs even at the organizational level. It's such a living and breathing type of expertise and field that brings in multiple disciplines to really be able to see how we've shifted from a programmatic mindset of let's design something with this methodology and implement it and see how it works to something that is much more baked into how organizations are running their operations and doing business, so that when we have considerations of all the external factors, whether it's political or economical, that organizations can continue to focus on the fundamentals for the types of expectations we now have as employees and as organizations. So I think that has been a shift that I've seen in the field is having, going from the conversations around programs and whether that's like challenges in the workplace or being able to have, as you said, a lot of focus on training and education, to all the dimensions to really bring it into how organizations can do this through that roller coaster and different life cycles of business and turnover of leadership, and be able to have it be something that's super systematic and more effective at some of those outcomes that we're hoping for.
Yeah, you're raising the bar.
We're trying. I mean, I just want to stress how I've never been a part of something that has been such a multidisciplinary community, and I think that accentuates that these problems that we face require that cross sector, that interdisciplinary. Some call it team science, some call it interdisciplinary work. But at the end of the day, it's very human in itself that if we need to solve problems, we need collective action to be able to address these complicated challenges.
Yeah, I love that. And it is bridging that research into implementation, also with the perspective that these are humans.
Yeah.
So it's what have you seen in the typical like day-to-day of how you can actually apply total worker health principles from taking that research into implementation?
Some of the things that we are seeing in the day-to-day is this shift in how organizations are approaching how, and the different starting points. So we have organizations that are from across the board as far as our work with Health Links and the work that we do to really help equip organizations to take stock of what they're doing, to look at what their organization and their employees need and want, and then also be able to help design strategies or actions that can really help start small. And I think that has been what we've seen is this, the day to day has been around how more people can get involved in the decision making around total worker health and safety and well-being in a workplace, and then how some of the focus areas might be with mental health, but the conversation then starts to revolve more around holistic approaches. What's the connection between mental health on a construction site, some of the things that construction teams might be facing, and safety implications? And so what we're starting to see on the day to day is that these conversations are being integrated into team huddles. They're being integrated into decision making at the mid-level manager, supervisor, and owner executive levels, but that it's throughout these organizations where we're starting to see some deeper dive areas across mental health, across chronic disease prevention and management, across but what we're calling now belonging, and being able to really think about how to support the lived experiences of all employees, and also a focus on recovery and seeing how organizations can support employees that are dealing with mental health, substance use disorders, and really needing support for seeking treatment and recovery, and a workplace that supports them throughout that.
Amazing. Such good work. Starting small, holistic perspective. That's amazing. The folks that are watching, you're going to see Lili's face all the time if you register, but she is also going to be part of 2 different sessions. So you want to tell us a little bit about those sessions that you'll be helping to lead or be participating in?
Yeah, sure. So the first one that I'm going to be leading is on a project called We Can Work. It's been a 5-year longitudinal study that our center has been leading to connect oncology care teams with occupational medicine physicians. So these are traditionally the doctors that help injured and sick workers. And so it's super novel. It's been this intervention that we've been running with UC Health, that's based at the University of Colorado Anschutz Medical Campus. And the oncology care teams have been incredible. There's been a huge appetite to be able to have cancer patients that are recently diagnosed and going through cancer treatment, to support them by creating a new referral to talk to an occupational medicine physician and get the support they need so that they can keep working through treatment. And so many cancer survivors experience what we call job lock, or they're underinsured, and these treatments are expensive, and they need and want to stay in the workforce for so many reasons. And so this presentation is going to be on our opening day, Wednesday, October 22nd. And we're going to be talking about the findings of this intervention to intersect oncology with total worker health. So super excited about that one. The other one is going to be a session with all 10 centers of excellence for total worker health across the country. And we're going to be talking about unleashing the power of outreach. And so this session is going to be led by Dr. Diane Rollman. She's out of Iowa. And we're going to have just a fun discussion about what all the centers are doing and how we can learn about translating and disseminating research into.
Awesome. That's awesome.
Yeah.
So if you guys are registered, join Lily's session, and my session will be going down in the business showcase portion. So it's at 10:15 Mountain Standard Time, which is 11:15 Central. It's called Move at Work Challenge, Driving Employee Happiness and Health. And don't forget, folks, you can still register. You have till today, the 17th at midnight. And thank you, Lili, so much for being here.
Thank you so much, Dr. Sarah. Thanks for the invitation. Thanks for all you're doing to talk with the gamut of Total Worker Health Symposium speakers. We're excited for next week. We'll see you there.
Awesome. Happy Friday, everyone.
Happy Friday.
Good.